You have no credibility. You have no qualifications. You fail to support your opinions. Like, oh, it's the absolute destruction. This debate bro judge is just like slamming them so hard. Based federal judge Moody. This guy is literally like a debate bro judge, and he just issued a scathing ruling on an anti-trans bill in the state of Arkansas, where he struck it down as unconstitutional. And as part of the ruling, what's so amazing, this 80-page ruling contains a section that are the findings of the court, the statements of fact, and it has more than 300 statements of fact with references and sources about how everything that the ban on trans healthcare for children was proposing as the reasons to ban this healthcare was just completely misleading, unevidenced, had no basis, and had no legal precedent. Amazing. Like, he's literally the debate bro who pulls out the research document, but like he releases it as the court document. Fantastic stuff. Honestly, for anybody that's, you know, kind of new to like what trans rights within like the legal system look like, how, you know, the court system is going to handle this, like, we're having a moment of sanity where this judge is just laying out the facts. No feelings, only facts. There's so much hilariously good stuff in here. One of the things that's like kind of surprising about legal cases is that like there are some amazing judges that just write, like, they write some like real snappy statements that are just so hilarious. Here's a footnote that says the Arkansas legislature titled the act, which is banning trans healthcare for minors, as Arkansas Save Adolescents from Experimentation, SAFE Act. And the judge says, because the title is misleading, the court will refer to the act as Act 626 in this order. He's like, nope, you don't get to use a misleading title. It's Act 626. Get it out of here. Like, it's so snappy. It's so good. Let's just get into the findings of fact, because there's a lot of really good stuff here. So first, it starts out with just an overview of like gender identity, terms like cisgender, transgender, gender incongruence, fantastic stuff like no evidence that gender incongruence is the result of a dysfunctional family life. Many trans people come from healthy, supportive families. Gender identity is not something that you can, as an individual, control or voluntarily change. While also acknowledging that, conversion therapy is bad. Conversion therapy harms people. Conversion therapy is ineffective. It's considered unethical by all major health organizations. Gender identity can be fluid over the course of a person's lifetime, but it's not because of a voluntary change, but rather that you can understand yourself better over time. The research shows that detransition is exceptionally rare. More terminology. So it acknowledges there is an evidence of rise in referrals to gender clinics in the United States in recent years. This increase in gender clinic patients is not surprising, given the undisputed testimony that there is an increase in awareness of gender dysphoria and an increase in the number of gender clinics and insurance coverage for treatment, making such care available when it previously was not. Acknowledging that, yeah, there are more people going to gender clinics, but this is completely normal because there are more gender clinics and there's more awareness around the topic. Like, he's literally making the left-handed argument without specifically bringing up the analogy. Fantastic stuff. If any adolescents are seeking care at gender clinics because of social influence, they would not meet the criteria of gender dysphoria or be considered for gender-affirming medical treatment unless they had a long-standing incongruent gender identity and clinically significant distress. Like, literally saying the idea of transness being a social contagion is completely bunk and nobody would be offered treatment if they were like a social contagion case that's not really trans. Amazing wording right there. Literally every major medical institution supports trans people and trans healthcare. The WPATH and the Endocrine Society are two major medical professional associations that have widely accepted clinical practice guidelines for treating trans people. More stuff about WPATH and Endocrine Society. Over 15,000 endocrinologists. Fantastic stuff about how literally every major medical institution supports trans people and trans healthcare. Arguments about informed consent, saying that WPATH standards and Endocrine Society guidelines have provisions for informed consent, essentially saying that, in general, the way that adolescent healthcare works is that we recognize that adolescents don't have the same capacity for informed consent that adults do. So instead, they use the consent-assent model, where the adolescent has to provide assent for a medical care, and then the adults and the psychiatrists that they're working with provide the informed consent based off of risk-benefit analysis. So essentially, it's saying even when adolescents are able to understand the risks, benefits, and alternatives, their parents and guardians are still required to provide informed consent, in addition to their assent. The assent of adolescents, meaning their agreement with the proposed course of treatment, should be obtained. For hormonal therapy, WPATH standards and endocrine guidelines specifically provide that patients and their parents and guardians must be informed of potential impact to treatment on fertility and counseled on options for preserving fertility. Like the idea that people are being sterilized without knowing it is just completely false, given all available guidelines. Before any potentially irreversible medical treatments, families should be informed that some individuals may come to feel gender-free medical care is not a good fit for them, as their feelings about gender identity could change. This is also common in any kind of procedure where they'll talk about there are different options. You know, you could do nothing. Some people might experience regret. Completely common stuff in all of medicine. This is another one that's really good at debunking recent talking points, where you'll see a lot more of kind of like the centrist transphobes or like the turfy transphobes be like, you know, I'm just really concerned that like autistic girls or people that are suffering from depression, they're not really trans, they're just suffering from autism or depression. First off, like autism is something that's like suffering and not just a different way that people's brains can exist and work. In some cases, mental health diagnosis may impair an individual's medical decision-making capacity, in which treatment would be delayed, and they have citations for that. Having a mental health diagnosis does not necessarily mean that an individual lacks medical decision-making capacity. Citation: if a patient suffers from depression or anxiety, that does not mean they cannot consent to treatment. Oftentimes, the depression or anxiety is a result of the gender dysphoria and not like the cause, where the actual cause of the depression and anxiety is the gender dysphoria. And he goes more into this later. So here's talking about how the process of trans healthcare actually works, where the first line of defense is psychotherapy, gender therapy, trying to figure out co-occurring psychiatric conditions, as well as doing gender therapy to help assess just how people have come to understand gender identity, how long that's been a thing, what are the struggles they're dealing with, helping them explore different options, as well as just explore their identity. Fantastic stuff about gender therapy, then discussion about how puberty blockers work, discussion about how hormones work, fantastic stuff if you're interested in that, discussion of how surgeries work, also talking about how the guidelines do not recommend surgery until after the age of 18. In rare cases, some surgeries happen, but this is based off of lots of psychological assessment. Yeah, with great caution after a thorough assessment of the patient's maturity. Let's see. I'll hear specifically about gender-affirming care in Arkansas, talking about the Arkansas Children's Hospital. They've seen about 300 patients since it opened in 2018. By the way, that's not a lot of like trans, like if all of the trans youth they saw since 2018, that'd be like 5 years, was 300. That would mean they saw like 60 trans kids a year. And this is the primary provider of gender-affirming medical care for adolescents in Arkansas. Pretty small numbers overall. The bill essentially caused Arkansas to stop providing medical care for patients, that this is causing real problems and distress for patients. Sometimes the gender clinic staff do not feel some adolescent patients are ready for gender-free medical interventions, and treatment is not provided in those cases. Only 4 of the 300 plus patients have been treated with puberty blockers, because most patients come in at older ages when that treatment would not be indicated. Here's their criteria for hormone therapy, which contains a lot of stuff. They have to be assessed by a psychologist, diagnosed with gender dysphoria, persistent, consistent gender identity, be in counseling with a therapist. Patient's therapist must be consulted and must not identify any concerns, have to have the cognitive maturity to understand and weigh risks and benefits. Parent provides informed consent. Patient receives a medical assessment, including baseline lab work, and they're at least 14 years old. A lot of screening and stuff that goes into this, and just laying down the facts, talking about the psychological analyzation, which identifies gender dysphoria, degree of dysphoria, sources of stress, and other psychological assessments, things like depression, anxiety. So essentially, they're also trying to figure out if there's any kind of comorbidities or perhaps other reasons that somebody might be struggling in that kind of way. Assessment of patient maturity based on information from parents, clinical psychologist, clinic physician, and the patient's therapist. If they do not demonstrate maturity, they will defer medical treatment. If there's concerns, they will delay treatment. No minors provided hormone therapy unless the patient, their parents, their doctor, the clinical psychologist, and the patient's therapist all approve of treatment. Lots of stuff that goes into this. Then this next section is essentially going over a couple of families that are actually the ones who are suing the state. And it gives a little bit of details about each family's story. So we have this one trans kid named Dylan, who's been transitioning via that clinic. Mood improved after he started to be recognized as a boy. Referred to the clinic. Eventually, Dylan began testosterone therapy, made by his mother, clinical psychologist, his therapist, Dr. Hutchinson, and himself. Everyone agreed it was appropriate. They were all informed of potential risks. As a parent, Joanna routinely makes medical decisions for her minor children. Dylan has now been on HRT for 2.5 years, and it's significantly alleviated his dysphoria. He has not experienced any negative side effects, and he's continued regular therapy with a counselor. If the law were to go into effect, it would forcibly detransition him, which is not an option for Dylan. His mother, Joanna, fears that stopping treatment would negatively affect his mental health and he would lose all of who he had become. Dylan and Joanna have discussed moving out of the state or traveling out of state regularly for treatment if he cannot continue receiving treatment in Arkansas because of Act 626. Horrifying stuff that's like actually destroying families if this law is passed and upheld. We have four separate families, all that have trans kids, all that are like, this would be horrible if the act were to be enforced. Our kids are completely different people, happy, healthy, since they've been allowed to transition. And the authoritarian government is trying to get in the way of doctors making these decisions. Now we have a section on studies and findings of treatments prohibited by Act 626. Here's where he pulled out the research doc. Decades of clinical experience with adolescents show that gender dysphoria experience significant positive benefits to their mental health and well-being from gender-affirming care. The long-term effectiveness is fantastic, as some adolescents with gender dysphoria are able to discontinue antidepressants and anti-anxiety medications after receiving gender-affirming care. There are 16 scientific studies assessing the use of puberty blockers and hormone therapy to treat adolescents with gender dysphoria, and this body of research found these treatments are effective at alleviating gender dysphoria and improving a variety of mental health outcomes, including anxiety, depression, and suicidality. The studies evaluating the use of puberty blockers saw improvements in mental health, or that patients did not experience worsening of mental health, which is typically the case when children with gender dysphoria go through puberty. Fantastic line right there. I've seen a lot of people do some fear-mongering about puberty blocker studies that are like, well, you know, it really shows that the kids stayed like about the same. They didn't really improve all that much on the puberty blockers. That's the point of the puberty blockers, because we know that the mental health outcomes of trans youth get much worse at puberty. The whole point of the puberty blockers is so that they stay the same. Like that's the medicine working as intended. It's a medicine that's trying to buy time, not trying to completely, you know, alleviate all of the dysphorias. Studies evaluating hormone therapy had similar findings, the results of dozens of studies on adults. Both sets of studies found significant improvements in mental health. Also, more based stuff about how you can't make broad conclusions about medical care from a single study in any area of medical research, but rather you need to look at the body of medical research as a whole, which shows that gender-affirming medical treatments are effective at improving mental health outcomes for adolescents with gender dysphoria. Evidence supporting gender-affirming care for adolescents is comparable to the evidence base supporting other medical treatments for minors. Once again, like in every area of medicine, we are working with a body of studies that's going to have strengths and weaknesses and limitations, and this is true for all of adolescent medicine, all of adult medicine too, not just trans medicine. The evidence available supporting gender-affirming care includes scientific studies, cross-sectional, longitudinal, and clinical experience. Defining what those are, there are no randomized controlled trials evaluating the efficacy of gender-affirming medical treatment for adolescents. Such research is not possible because it would not be ethical or feasible to have a study in which a control group is not provided treatment that is known from clinical experience and research to benefit patients. This is another thing where once we have a medical treatment which has been established and backed by medical care guidelines, it is unethical to deny people treatment and force them to go through irreversible changes and damages from not being offered that treatment. Randomized controlled trials are only happen in research settings where we don't know if a treatment's effective. Additionally, here's another one that's really a really good point. It would not be possible to do a randomized controlled trials because you can't blind the studies to researchers, given the obvious physical manifestations of the treatments. So essentially what they're saying is if you want to do a randomized controlled trial with HRT, you would be able to know who got the HRT and who didn't just by looking at the kids or just by hearing their voices. The physical manifestations of HRT would make it impossible to properly blind the analysis. So it's not even possible to do these trials for trans people. It is common for clinical practice guidelines in medicine to make recommendations based on low or very low quality evidence, such as cross-sectional and longitudinal studies, across all of adolescent medicine. Is that in a different section? There's another section where they talk about how the phrase high quality evidence has been abused, because essentially high quality evidence means randomized controlled trials, but there are lots of medicines that don't have randomized controlled trials that we specifically and routinely prescribe even to adolescents. As with all medical treatments, gender-affirming care can have potential side effects, and they are weighed against the benefits. The risks of gender-affirming medical care are not categorically different than the types of risks associated with other pediatric health care. For many adolescents, the benefits greatly outweigh the risks, talking about how it alleviates gender dysphoria, improves mental health, enables them to engage in school and social activities. Adverse effects are rare when treatment is provided under the supervision of a doctor. Evidence showed that the risks associated with gender-affirming care is comparable to the risks associated with many other medical treatments that patients are free to choose for their adolescent children after weighing the risks and benefits. Off-label use of drugs is both permitted and common in Arkansas, and in all of medicine, by the way. There is nothing unique about the risks of gender-affirming medical care for adolescents that warrants taking this medical decision out of the hands of adolescent patients, their parents, and their doctors. Based right there. Like, you would have to have something that is insanely categorically different than other types of medicine to say the government knows better than patients, parents, and doctors. Common for adolescents to undergo medical treatments that carry comparable or greater risks than gender-affirming medical care. Other treatments for minors that even impair fertility, such as treatments for rheumatologic conditions, kidney diseases, and cancers. Some of these treatments are also provided at the Arizona Children's Hospital when appropriate for the patient. Patients' families are similarly informed of the risk and weigh it, deciding whether or not to undergo the medical treatment. Except for the risk of fertility, the risks associated with puberty blockers, testosterone, estrogen, and antiandrogens are the same for cis people, regardless of the condition that they're prescribed for. Puberty blockers used for other uses. Hormones are used for other uses. We have a lot of research showing that these have been studied in other uses. Oh, they also beautifully address concerns about bone density on the puberty blockers. So what it says is, as expected, an expected effect of puberty blockers is the delay of rapid accrual of bone mineralization that occurs during puberty. While the patients are on puberty blockers, they continue to accrue bone mineralization at the prepubertal rate. So it doesn't stop you from improving your bone density, it just keeps it at that pre-puberty level of growth. Once the blockers are stopped and puberty resumes, either the person's endogenous puberty or an exogenous puberty prompted by hormones, the accrual of bone mineralization increases at the usual pubertal rate. And generally, a patient will reach the normal range of bone density within 2 to 3 years after they're on gender-affirming hormones or they go through an endogenous puberty. So literally, most people that are on puberty blockers literally end up within normal ranges of bone density. And those who do not achieve full bone density tend to have low bone density and risk factors prior to starting treatment. Puberty blockers are fully reversible. If an adolescent discontinues treatment, endogenous puberty will resume. Patient treated with puberty blockers stops treatment and resumes their endogenous puberty. The medication has no impact on fertility. Slam dunking all of the claims and fear-mongering that people try to do about puberty blockers with citations at every line. Fantastic stuff. Top surgery, and saying that it's literally the same as mastectomy or breast reduction in cis girls, also gynecomastia surgery in cis boys. Here's the section where they talk about how detransitioning is exceptionally rare. In Dr. Krasik's clinical experience treating thousands of patients with gender dysphoria over 30 years, none of his patients came to identify with their sex assigned at birth after medically transitioning. Fantastic testimony right there. The reason why they might have halted medical treatment was lack of insurance coverage or fear of losing family support. Some of these patients later resumed their medical transition. None of the patients who stopped or paused medical transition did so because they came to identify with their sex assigned at birth. Detransition is taken seriously. People are informed about risks, talking about the quote-unquote watchful waiting approach and how it's not as effective. They had 2 testimonies from detransitioners that this is really crazy. So they stated they feel regret about their medical transitions. The court finds these anecdotal experiences credible, but also irrelevant to the issues to be decided. The witnesses' experiences are irrelevant to the case, given that 1, neither sought nor received gender-affirming care as a minor. 2, both transitioned as adults. 3, neither was treated in Arkansas. 4, they both detransitioned as a result of a religious experience. And 5, continue to struggle with living consistently with their birth-assigned sex after deciding to detransition. Like, the best detransitioners that the transphobes could bring in for this case, that they flew out from out of state, never got gender-affirming care as a minor, didn't get gender-affirming care in the state, it was due to some religious conversion, and they continue to struggle with their gender identity. So it's clearly cases that are just not disproving the overwhelming case of trans people that genuinely benefit from gender-affirming care. Here's talking about regulation of medicine in Arkansas, talking about how if we're going to regulate medicine, this should be done by the Arkansas Board of Medicine, not by a legislation, and how the legislation has enacted policies, particularly in cases where they might want additional screening for certain medical conditions. For example, I think the example they use was talking about because of serious risks related to gastric bypass surgery, they established additional informed consent requirements before a doctor could perform gastric bypass surgery, essentially saying they could have tried to do this with trans healthcare, but they don't even have justification to do so like they did in the gastric bypass surgery case. They're saying the most comparable case we have was when they added additional requirements for gastric bypass surgery, but they had justification to do so. the transphobes do not have justification to do so, and they went through this through the wrong channels. The board has not considered passing any regulations concerning gender-affirming medical care. No one at the board ever suggested that they saw a need for regulation concerning gender-affirming medical care. If there's an issue regarding overprescription, they can always propose a legislation or a regulation to address that, as they did for overprescription of opioids. Just like fantastic stuff about how the transphobes were in the wrong at every state of this. There are policy concerns expressed at the trial, where literally every major medical institution testified that this would hurt doctors' ability to perform any care at all in Arkansas. Harms to the various families, irreparable for adolescents with gender dysphoria who need but aren't able to access gender-affirming medical care, essentially causing them to go through permanent changes. Denying gender-affirming medical care to adolescents with gender dysphoria until they reach 18 means their bodies would go through irreversible pubertal changes inconsistent with their gender identity. Puts them at worsening risks of anxiety, depression, hospitalization, and suicidality. This will impact adolescents with gender dysphoria who need but are unable to access care. Not all adolescents with gender dysphoria will even live to 18 if they're unable to get gender-affirming medical care. Testified that they would expect doctors to find a way to help patients, even providing treatment in violation of the law because of how important this is. Essentially saying that this law would cause civil disobedience due to how big of a deal it is. Discontinuing treatment is devastating and would decrease like congruence and ability to like actually interact in society in the way that trans youth need to in order to be happy. Now we have the battle of the credentials. This part's great. So essentially, the plaintiff's expert. Here's the team of doctors that are saying, "Hey, gender-affirming care is important. We need this." We have an amazing team of Dr. Karasik, who has over 30 years of experience treating people with gender dysphoria, professor of psychiatry at University of California, San Francisco, faculty since 1991, Yale School of Medicine, residency at UCLA, fantastic track record. Worked for the WPATH, worked on the DSM-5. Many of his patients were profoundly impaired by gender dysphoria. He has patients who were withdrawn from school or social interaction, patients who were suicidal or made suicide attempts, patients who engage in other forms of self-harming prior to getting treatment, and obviously this resolved with treatment. We have Dr. Adkins, 22 years of experience as an endocrinologist. That's like a hormone doctor, associate professor of pediatrics, treated approximately 600 adolescent patients with dysphoria.
Have you seen this
and she treats patients for a variety of other conditions requiring hormonal therapies. We also have Dr. Jack Turbin, child adolescent psychiatrist, focuses on gender dysphoria, has published over 20 peer-reviewed articles on the subject of gender dysphoria. We also have Dr. Anta Maria, pediatrician, pediatric hospitalist, and bioethicist. All of his medical credentials. Dr. Catherine Stambo, a lot of medical credentials. She actually worked at the Arkansas Children's Hospital. She is currently seeing 248 patients at the gender clinic, providing hormone therapy to 81 patients. And she would be unable to provide medically necessary care to patients if this act was enforced, and she would be forced to leave them to needlessly suffer. Plaintiff's expert opinions generally says plaintiff experts' extensive experiences, their testimony in court, and their demeanor and responsiveness to questions asked by both sides and the court show that all four of plaintiff's expert witnesses have deep knowledge of the subject matter of their testimony and were fully qualified to provide the opinion they offered. They have provided credible and reliable testimony relevant to core issues in the case. Now they're going to get into the state's experts. So these are the doctors that are on the side of transphobia, and here's their credentials. We have a licensed physician. Dr. Levine was the state's only expert witness who has experience treating patients with gender dysphoria. In his practice, he has enabled minor patients with gender dysphoria to access hormone therapy on a case-by-case basis. This doctor of the state does not support banning gender-affirming medical care for adolescents with gender dysphoria, and he has concerns about the act's impact on youth. So essentially, like, this doctor was essentially like, I have some concerns, but like you can't ban this stuff. And this was the only doctor that the state had that worked with trans people on the state side of things. Oh, this is 292 is hilarious. It says, Dr. Levine testified that doctors who provide gender-affirming medical care to adolescents with gender dysphoria encourage patients to identify as transgender and provide hormones immediately without assessing patients and addressing other mental health conditions or informing patients and their parents of the risks and limitations of the evidence regarding treatments. He offered no evidence that treatment was being provided this way in Arkansas or anywhere in the United States. He conceded he has no knowledge of how most gender clinics provide care, and thus does not know how common it is for care to be provided in the way he described. He further does not know how care is provided by doctors in Arkansas. Like, literally, it says that he made a wild claim about how gender affirming care is, like, given to kids just for asking nicely. And then, like, okay, but, like, have you seen it? Like, you have any evidence of that? And he's like, no. And now they're just tearing him to shreds in the statement about how he offered no evidence, conceded instantly, does not even know how this care is provided. Like, the court found Dr. Levine a very credible witness who struggles with the conflict between his scientific understanding for the need for transgender care and his faith. We have Dr. Regnerus, who testified that gender-affirming care for adolescents is grounded in ideology rather than science. His testimony did not offer any support for his conclusion, and the court finds that there is no evidence to support this assertion. He's a sociologist who has worked on sexual relationship behavior and religion, has no training or experience related to the fields of medicine or mental health care, or the treatment of gender dysphoria. He has never worked in a medical or mental health clinical setting. The court does not credit the testimony of him and gives it no weight because the court finds that he lacks the qualifications to offer his opinion and failed to support them. Fantastic stuff. You have no credibility. You have no qualifications. You fail to support your opinions. Like, oh, it's the absolute destruction. This debate bro judge is just, like, slamming them so hard. Dr. Patrick Leppert is a plastic surgeon. This is another one. This crazy footnote right here says that it's not the first time that Professor Regnerus's testimony as an expert witness was questioned by the court, and it's going through a history of him providing testimony that gay parenting caused adverse outcomes in children, which was entirely unbelievable and not worthy of serious consideration, and also a fringe viewpoint that was rejected by the majority of the study's authors, colleagues across a variety of social science fields. So he has a history of, like, going on to court cases that, like, religious bigots have an investment in and just testifying on the side of bigotry. And he's like, oh, by the way, he has a history of doing this. Dr. Leppert has no training or professional experience in mental health or gender dysphoria and has never provided gender-affirming surgery. He acknowledges that he is not an expert in the treatment of gender dysphoria. Like Professor Mark Regnerus and Dr. Paul Hrues, Dr. Leppert was recruited by the Alliance Defending Freedom at a seminar held in Arizona. Crazy stuff that they're exposing, that they were that all of these hack doctors were recruited by a conservative political organization that is trying to get trans people's rights taken away. ADF is an organization committed to protecting God's design for marriage and family, essentially saying not a scientific organization, all based off of religious bigotry. Saying that these three doctors were testifying more from a religious doctrinal standpoint rather than the required of experts by Dobert. Fantastic stuff. Saying that they're not giving expert testimony, they're just giving religious bigotry. Offered opinions regarding the circumstances under which he believes cosmetic or aesthetic surgeries are ethically appropriate in adults and minors, and the potential risks of various surgeries outside the context of gender transition. The relevance of his testimony was unclear. The court finds that he is not qualified to offer relevant opinions given his lack of experience in gender dysphoria, and he does not meet the requirements under, I believe this is another case, to give opinions relevant. Acknowledged that his own opinions were his own and were inconsistent with his peers and the American Society of Plastic Surgeons. So, like, literally they got him to admit, yeah, I just disagree with the mainstream because of my religious views. We also have Dr. Hrues, pediatric endocrinologist, has never treated a patient for gender dysphoria. The legislative findings assert that there is insufficient evidence of the efficacy of gender-affirming medical care for minors. He was a witness, offered opinion to that effect. The court does not credit these opinions because it finds that evidence showed decades of clinical experience, in addition to a body of scientific research, demonstrate the effectiveness of these treatments. For the same reason, the court finds that the treatments banned by Act 626 are not experimentation on youth, as suggested by the Act's title. Oh, this is so good. This is so good. So here's the concerns about low-quality research. Dr. Hrues says that they should disregard the body of research because it's low quality. The court declines to do that. The court finds that the quality of evidence supporting gender-affirming medical care is similar to the quality of evidence supporting many other medical treatments for minors and their families. While the court recognized the study on gender-affirming medical care for adolescents, like studies in all areas of medical research, have strengths and weaknesses, it does not credit Dr. Hrues' assessment that the entire body of research is therefore meaningless. The body of research, taken as a whole, shows these treatments provide significant benefits to adolescents with gender dysphoria. Like, okay, so you don't like the studies, but, like, it doesn't discredit them. All studies have strengths and weaknesses. Like, nice try. Dr. Hrues also testified about the risks of puberty blockers, testosterone, anti-androgens, and estrogen, suggesting that this is a basis to prohibit gender-affirming medical care for adolescents. The weight of the evidence speaks to the contrary. And also, these risks have not prevented Dr. Hrues from providing these very same medications to cisgender patients in his pediatric endocrine practice. They literally called him out on the double standard, where he's like, he testified that all of the endocrine medicines, they're too risky. They're so risky. And then the court's like, yeah, but you readily provide them to cisgender patients, and the risks are the same to cis patients and trans patients. So like, why the double standard? And then here is their findings of the dependent expert positions generally. The state suggests that Act 626 is consistent with medical guidelines issued by nations around the world. Their experts reference guidelines issued by government authorities in Sweden, Finland, UK, but the court finds that the evidence showed that none of these guidelines have prevented gender-affirming care for minors. So once again lying, talking about how in those countries, they still provide gender-affirming care to adolescents with gender dysphoria when indicated under their guidelines. And here's the final finding of fact. Most of the state's expert witnesses were unqualified to offer relevant expert testimony and offered unreliable testimony. Their opinions regarding gender-affirming medical care for adolescents with gender dysphoria are grounded in ideology rather than science. He stole the guy's line because it actually applies to them. Fantastic stuff. He stole the bigot's line and said that actually, based on all available evidence, you're the one who's grounding your claims in ideology rather than science. See also similar cases, comments on expert testimony, and more citations. And then in conclusion, based off of all constitutional precedent, all of the claims of the transphobes are bunk, and in conclusion, this law is unenforceable. Federal judge based debate bro takedown of all of the horrible quote-unquote expert testimonies trying to be transphobic and get kids taken off of their life-saving medical care. Judge Moody based debate bro judge defender of trans rights. And also another like little tip to why voting matters is Judge Moody was appointed by Barack Obama. Like, if Obama didn't win the presidency back in 2012, he would not be a judge. He would not have been able to issue this ruling. Like, being able to set federal judges in the Supreme Court is one of the biggest W's that we can take if we get a Democrat elected to president. The amount of power that the courts have is insane, especially as we've seen recent rulings, like the fact that the Supreme Court just said that now you can discriminate against gay people in your businesses. The Supreme Court also said that like affirmative action is overturned. Like these court cases matter a lot, and these judges have a lot of power. And it's only because Obama was elected president that we got this judge to now defend trans rights in 2023. The other thing that's fantastic about this is if they decide to appeal this all the way to the Supreme Court, now the Supreme Court is going to have to contend with these statements of fact that are attached to the case. Like, these findings of fact are going to be forever attached to the case and have to be dealt with in order to take the case any further. Like, not only did this judge demolish the opposition with facts and logic, he also permanently made it impossibly difficult for bad faith transphobic doctors to attempt to appeal this further, because all of the evidence and all the citations are right here in over 300 findings of fact that a further appeal would have to deal with. We need a show, like, I want Judge Moody to be the next Judge Judy, because he deserves it. I would watch him. I would watch him work.